Looks like we still have a few people joining. We'll give it another minute or so and then we'll start. Good afternoon, everyone, and welcome to this National Bleeding Disorders Foundation Wednesday webinar. My name is Fiona Robinson, and I will be your host today. The title of today's webinar is Understanding HYMPAVZI, marstacimab. We would like to extend a special thanks to Pfizer for making today's webinar possible. This webinar is being recorded. The recording will be available shortly after it ends on the NBDF website, bleeding.org. We encourage you to ask any questions you may have today. You could ask your questions by using the Q&A feature at the bottom of your screen at any time during the webinar. We will monitor your questions, and then following our speaker's presentation, we will put your questions to them as part of our live Zoom webinar. Today, we are joined by Brad Schoenfeld, Hemophilia Advocacy and Community Engagement Team Lead at Pfizer. I'd like to thank Brad for joining us today, and I will pass things over to him now to get us started.
Thank you so much, and welcome everyone. Appreciate your attendance. Hopefully I'm reaching everybody well. I do want to say thank you to the National Bleeding Disorders Foundation for inviting me here today on behalf of Pfizer to offer up a little bit more understanding on HYMPAVZI, one of Pfizer's treatment options for hemophilia A and B, which definitely look forward to talking about, and at the end have a chance to field some questions. So as Fiona mentioned, definitely as I'm going through it, pepper the chat with some comments. Maybe I'll address some of those questions as we move through it, but if not, we'll certainly have some time at the end. And I just want to say how valuable it is for you all to show up. But beyond that, how valuable it is for you to share your voices with organizations like the National Bleeding Disorders Foundation, as well as with your local chapters, because there's a through line there for your collective voice in the community, going to organizations, and then that coming to us. So much of what you're going to see today that I'll be walking you through, really at its core, the foundation of curiosity and in the inquiries, that has shaped our content so very much. So again, NBDF, we appreciate you for this invitation, and to the collective community, thank you for having us here. So today again, HYMPAVZI. Some of you may have heard of HYMPAVZI already. Some of you may have not heard about it, but maybe you've heard about marstacimab. Marstacimab was the product's name or the asset's name when it was in clinical study. Since it met FDA approval, the commercial name, really that's what happens after FDA approval, it becomes a commercialized product. The commercial name for HYMPAVZI, now that it's on the market in the United States as FDA approved, the product's name is HYMPAVZI. But you'll see there, we'll always carry marstacimab with it. So if you're ever mentioning it, let's say to your healthcare provider, you say HYMPAVZI, they'll know what you're talking about. If you say marstacimab, they'll also know what you're talking about. So who am I beyond the guy in the box? So my role within Pfizer is that within our engagement team, and we are the sole team within Pfizer specifically that sits under our rare disease portfolio. Within that is hemophilia. Hemophilia, because the therapies that we have approved and available as treatment options are specifically indicated for hemophilia A and B. So when you hear persons at Pfizer saying hemophilia and not bleeding disorders, therein lies the reason why, just to make you aware of that. But then within Pfizer, our team is the single team that persons in the community can have a direct through line, a direct point of contact with Pfizer. And that contact is here for as long as you may need, whether it's a simple question or whether you want to stay in touch throughout, let's say, the hemophilia care continuum. Wonderful that you're here, you're connected with NBDF. Presumably you're connected with a local chapter organization, all of which is wonderful. There may very well be moments in time where you have some unique needs and or questions for an organization like Pfizer. So later in the presentation, when we come to the end, we'll be sharing a link in the chat should anyone want to get directly connected with us and perhaps more in touch locally, because that's our team. We have members all throughout the country who are more local to your neighborhood. So it's a pleasure to speak to you here today. So on the agenda for us, we'll be talking about Pfizer a little bit related to the hemophilia community, and then getting into marstacimab, going through its indication, important safety information, an overview of HYMPAVZI, and we will take some time looking at the clinical study, specifically the phase 3 basis study on which this therapy came through for approval. We'll talk a bit about the device itself, how it's administered, and then help you understand a little bit how you can get support for things like access and reimbursement if this is a therapy that you may choose to pursue. So some disclosures, not atypical for presentations like this, but it's important for you to know. This program is sponsored by Pfizer. Any discussion we have here today or information that I'm sharing, it is not to take the place of a healthcare provider. Those are unique experiences. How one therapy may work for someone may work differently for others. So again, encourage 2 things. Always consult with your healthcare provider for medical advice, and then also knowing that individual experiences on therapy are unique. Important safety information will be shared throughout this presentation, and we don't have any patients sharing their experiences on HYMPAVZI today, but should you attend a future educational program that contains lived experience, if you will, those individuals would not be employed by Pfizer, and we will always make mention whether they're on therapy, whether it was post-trial or within a clinical trial setting. So as we are about to get into this, we have 3 questions that we're asking of all of you. A link is going to also go into the chat. And this is going to help in 2 ways. One, gives us a little bit of a baseline for how we're meeting you all today, what you understand or don't fully understand or don't yet know on not only HYMPAVZI, but also the therapy itself, the treatment class, which we're going to be talking about. So I'll count to 5 in my head, leave this up a little bit. And again, this information is helpful because then it continues to shape the educational content that we bring forward to future meetings like this. And again, that link is in the chat, so you can toggle back up and find it at any point. So Pfizer and the hemophilia community, specifically in the United States. So Pfizer has been supporting the hemophilia community for over 25 years. Some of you might be familiar, some of you maybe not, but Pfizer had an original class of therapies that was factor replacement therapy, standard half-life class for hemophilia A, and another for hemophilia B. Both were competent. Now, from October of last year, this is when HYMPAVZI became FDA approved, and as you're starting to maybe hear or will hear about rebalancing treatment, rebalancers, think of that as a therapeutic class, a therapy class of medications. So HYMPAVZI fits within as a rebalancing treatment within that class. It is not factor replacement therapy. And we'll get into more of this, but just at least right up front, helping to start to distinguish the two. So what is HYMPAVZI? We get questions about this all the time. It came out, like I said, in October of 24. So HYMPAVZI is a prescription medicine used to prevent or reduce the frequency of bleeding episodes in adults and children 12 years of age and older with hemophilia A or B without inhibitors. So what does that signal to you? How do I interpret that? It is used for prophylaxis treatment, preventative treatment, and we'll talk about how, why, like, does it work for hemophilia A and B? And again, important to know that under the age of 12, it is not yet known if HYMPAVZI is safe and effective in children, again, younger than the age of 12. Just like with any medication, but specifically for HYMPAVZI, very important to talk to your healthcare provider about how you're using factor 8 or 9 products. As we know, those are products that help the blood clot, but work in a different way than HYMPAVZI. So take that into consideration, because what we're talking about here is prophylaxis. So it would be a consideration of making potential change if that's what you're pursuing. So it's not the same as going from one standard half-life factor replacement therapy to another. It's also not the same as going from, let's say, a standard half-life factor replacement therapy to potentially an extended factor replacement therapy. Why? Because those are both factor. You can talk about how they're different, but here, as we're going to be talking about HYMPAVZI, it is not factor replacement therapy. So again, you want to have those conversations with your healthcare provider as you may begin HYMPAVZI, and also while you're on HYMPAVZI, continue to be in touch on how this therapy is working for you individually. Before starting HYMPAVZI, of course, you talk to your medical provider about all of your medical conditions, including if you have a known surgery coming up, because potentially that might influence when to start, and also how to potentially use factor replacement therapy in combination with HYMPAVZI. Again, all of these components are individual conversations for you to have with your healthcare provider. Of course, if you have an illness, really short-term acute illness, you have an infection or an injury, these are all things to discuss with your healthcare provider. And for females, we'll talk a little bit about this, but females, if you're considering this therapy, absolutely conversations to have with your provider, but for pregnancy, or if you're planning to become pregnant, it is not known HYMPAVZI's impact on your child, on childbearing. So with your healthcare provider, they'll absolutely run a pregnancy test before you would start HYMPAVZI. And while on HYMPAVZI, you'd be using birth control or contraception during treatment with HYMPAVZI. And also, if a female were to stop using it for at least 2 months after the last dose of HYMPAVZI, continue birth control or contraception, again, 2 months after even stopping the medication. If you're a female on this therapy and you happen to become pregnant, talk to your provider right away and have to make it clear it is not known if HYMPAVZI passes into your breast milk. So important safety information. we're going to be talking about procoagulants and anticoagulants, where factor sits and where a therapy like HYMPAVZI sits. I'll share with you for right now up front that because of the mechanism of action or how it works in your body, there may be a risk for thromboembolic events, which are blood clots. And it's important to raise the symptoms so you have signs to watch out for. So some of those symptoms are swelling or pain in the arms and legs, redness or discoloration, shortness of breath, pain in your chest or upper back, fast heart rate, you happen to cough up blood, feel faint, headache, numbness in your face, in your eyes, or have some swelling, and trouble seeing. So again, we raise this because these are things to look out for and really catch them early. Same goes for potential for allergic reactions. Allergic reactions may include rash, itching. I mean, that has happened with persons with HYMPAVZI. But again, if we're talking about a severe allergic reaction, swelling of your face, lips, mouth, or tongue, trouble breathing, wheezing, dizziness or fainting, increased heart rate, sweating, and again, increased sweating abnormally. These are things where you could choose to stop your medication right away, but also contact your healthcare provider right away. And of course, seek medical attention. When in doubt, seek medical attention. So stating this up front as this broad disclaimer, if you will, to understand what you should be looking out for when starting a new therapy, specifically that of HYMPAVZI. We'll get into specific detail on the clinical study with what was observed to realize two things: safety and efficacy. So both of them have to be there. Is the product safe, and does the product work? We'll talk about that when we get to the portion within the clinical studies. The FDA has a hotline. I'll share with you. You could look it up online. If you search FDA reporting side effects, if you will, this will pop up for you quite easily. But always encourage to report that not only to your doctor, but you could report it to the FDA as well. So the most common side effects of HYMPAVZI are injection site reactions, headache, and itching. So let's take a minute to talk about how this therapy works. And again, this is where I'm encouraging everyone to think of the rebalancing class. It's intentional that we're looking at a scale where we're out of balance seemingly as we move from left to right, and then we're reaching the point where we're balanced. That is the concept. That is how the science was studied, was can we restore hemostatic balance in hemophilia and improve clotting function? So let's anchor for a minute all the way to the left. So here we can see we have one side of the scale that is anticoagulants, which prevent clotting, and another side of the scale, which is procoagulants, which promotes clotting. In my mind, I'm letting you into the mind of Brad here, the 6 circles that I see that are weighted more heavily, those look to me like eggs. So I'll call them a half dozen eggs. Over to the right on the procoagulant side, those look like pillowy clouds to me. So there's 5 of them. So right now, the eggs are weighing more than the clouds, and you see it's out of balance. If you look more closely, you'll see the count. There's 6 on one side, 5 on the other. That is really demonstrating the variance, the difference of the weight. So what I want to encourage you to try to think is what's missing. What's missing on the clouds there? There's a 6th cloud, if you will, that's missing. What's missing could be factor 8, or what's missing could be factor 9. Both of those are proteins that exist on the procoagulant side of the scale. The way this therapy was studied was, hey, what if we look at the other side, anticoagulants? What if we zero in on one of those proteins? So just like how factor 8 and 9 is protein on the procoagulant side, on the anticoagulant side, there are proteins as well. So now moving over to the middle, you'll see we're circling one of those proteins. The protein is TFPI, or longer form, it's tissue factor pathway inhibitor, which is a naturally occurring protein. It's an anti-clotting protein. So without factor 8 or 9, again, out of balance, we're tipping the scale. So here, when we move all the way to the right, how this therapy works is HYMPAVZI effectively blocks the FPI. You could see, like, we're representing it as taking it away. It doesn't get entirely removed. It's being blocked. But then what you have is balancing that occurs. So within that, these proteins can potentially restore hemostatic balance in hemophilia and, again, improve clotting function. One of the main takeaways here is anti-TFPI, because, again, it's an antagonist that's blocking TFPI. That therapy works independent of factor 8 or 9 levels. They're on completely two sides of the scale. And another way to think about this is, if you're on this therapy or prophylaxis or preventative therapy, if you were to have your blood taken and measure your level of factor 8 or 9, depending on what type of hemophilia you have, that factor level will show as if you're not on therapy. So if you're less than 1% of factor 8 or 9, that's what it'll show. If you have more moderate severe hemophilia, between 1 and 5%, again, that level is going to show. So we're not talking about the ups, the peaks, and the troughs of factor replacement therapy, because this is not factor replacement therapy. Here, where this is a rebalancing agent, and also important to know, there's no measuring of TFPI, how that's looking in your system with HYMPAVZI. HYMPAVZI is all about restoring hemostatic balance, steady state, once it's in your system. So how to take HYMPAVZI, I'll show you the device a little bit later, but this therapy is given as a subcutaneous injection once a week, and it's available through a pre-filled pen device. Your first dose, or your loading dose of HYMPAVZI, is 300 milligrams, which equals 2 injections. 2 injections that you would do in different places. So that can be in your abdomen, in the meaty part. It could be on your thigh, fatty tissue, or underneath your arms. And important to know, like subcutaneous, it's underneath the skin. So it's not intravenous, not in a vein, and it's not intramuscular or in the muscle. It is a subcutaneous injection into the tissue. What you're looking at there on the right, not to actual size, of course, especially if you're on your phone, it's a 150 milligram pen. So there is not a 300 milligram pen. So that is the need for the loading dose there with the 2 injections. And again, always encourage to reduce the risk of injection site reaction, to rotate the injection. So here, if you were doing 2, you may choose different sides of your stomach, or use your thigh in one injection and maybe your stomach in another. That's all right. After that, you take a single weekly dose of 150 milligrams, which is your maintenance dose as prescribed by your provider. We say maintenance dose, that's really your prophy dose. Your prophylaxis dose would look like a once-week injection. If more than 1 injection is required to deliver a complete dose, again, each injection, just rotate. And here, want to really convey, it's a pen device. It is pre-filled, pre-mixed. There's no mixing involved, and it's a single-use pen. Single-use pen that would go in your sharps container after you're through with it. And then further, there's nothing like a button to push, or there's no change in dosing. The dose is flat. meaning it is not weight-based. It is a flat dose how this is administered, meaning if you weigh 150 pounds and you know someone who weighs 200 pounds, they both may be taking HYMPAVZI, you're using the same dose. What to expect with HYMPAVZI? It's prescribed for preventing or reducing the frequency of bleeding episodes. Do not use HYMPAVZI for breakthrough bleeds. So think of it as if you're happen to be on factor replacement therapy today, you have your prophylaxis regimen, your dose is there, and then seemingly you would also have additional doses that would be used during periods where you may have a bleeding episode. May look the same, may look different, but those are two separate regimens, prophylaxis and for bleed control when you're actually bleeding. So for HYMPAVZI, we're really talking about this is another option for the use of prophylaxis. When there's a bleeding episode, you'll still use factor replacement therapy to control that bleeding episode. The regimen could look different. This is where everyone's unique, and you have this conversation with your healthcare provider. Say, hey, if I'm getting on HYMPAVZI, what should I consider if I am to experience a bleed? That's where your physician will have that discussion with you. So yes, you may need to use factor 8 or 9 medications to treat episodes of the breakthrough bleeding. And as a reminder, HYMPAVZI is used for prophylaxis to treat adults and pediatric patients 12 years of age and up without inhibitors. So if you have an inhibitor or you're under the age of 12 with hemophilia A or B, this therapy is not indicated for that. Let's look at the trial a little bit. There have been some, again, how we shape this information is based on feedback that we've collected, those frequently asked questions that we've gotten since this therapy has received its approval in October. So the BASIS 3 trial, that's the final trial that leads you to, let's say, a manufacturer like Pfizer, their submission to the FDA, and then the FDA reviews the data. So here, established safety of HYMPAVZI very early on in earlier stages. Now phase 3 is studied in a much wider patient base. And also it's still looking at safety, but it's also looking at efficacy, meaning does this therapy work? I mean, sure, it's been shown to work in smaller samples, smaller clinical trial participants, but now it's gotten larger. So the phase 3 study was 116 adults and adolescent males, again, ages 12 up, with severe hemophilia A or B without inhibitors. And within that 116, important to note, 83 of those individuals were on factor replacement therapy for prophylaxis use prior to coming into the HYMPAVZI, prior to starting HYMPAVZI. And the 33 that you see, those were moderately severe patients who qualified for the study. They were on on-demand therapy. So in those 33, those are individuals who switched from on-demand factor replacement therapy and moved to using HYMPAVZI. So clinical trial participants entered the study in a 6-month observational period where you would continue your existing course of therapy. They're monitored, they see how they're doing, and then make the switch to HYMPAVZI, and then those participants were monitored for 12 months, for a year. Let's talk about what was the study trying to establish. 2 objectives. The primary one was reduction of ABR, or annualized bleed rates, the rate at which you bleed. And here it's important to note, we're not talking about factor levels. What does it do for factor level elevation? Not relevant, because this is not factor replacement therapy. Secondary objectives looked at the incidences of spontaneous bleeds, incidences of joint bleeds and then incidence of target joint bleeds. So those could be two separate things. Someone might not have a target joint, but they could still bleed into their joint. So that was looked at, as well as individuals who identified and clinically presented. They do very much have a target joint. So that was documented to see how well they do. And then at the tail end, looking at total bleeds. So that would encompass things like inclusion of things like muscle bleeds, as an example. So here, I'm hoping it's not much of a surprise that in the top box there, significant reduction in on-demand therapy versus prophylaxis. So the on-demand therapy with factor replacement therapy, the annualized bleed rates for what the participants were documenting went significantly down. And again, that's moving from on-demand therapy on using factor replacement, moving to a prophylaxis regimen on HYMPAVZI was that reduction. But then looking further down, for the individuals who were on prophylaxis therapy using factor replacement, 8 or 9, that then switched to HYMPAVZI, again, prophylaxis for prophylaxis, just using the different therapy. Again, we do see a reduction in the annualized bleeding rates. And I didn't cover this earlier. I want to cover this off because I'm sure you might be thinking this, like, okay, the 116, I'm just going to back up a second. What does that actually look like? I'll quickly tell you. The median age in the trial was 32. The span of the ages was as young as 13, and it went to as old as 66 out of the makeup of this 116 individuals. 19 participants were between the ages of, again, that 12 and 18, or say 13 to 18. 91 out of the 116 had hemophilia A, and 25 have hemophilia B. Hopefully that was helpful. We hear that question a lot, so I wanted to make sure to cover that. So moving ahead to number of joint bleeds. So now we're going past the primary endpoint that the study was seeking to establish, and sort of look at secondary objectives. So number of joint bleeds. Again, going to start seeing some trends here that in the cohort that uses on-demand regimen moves to HYMPAVZI for prophylaxis, 91% reduction. And then for routine prophylaxis, again, factor replacement therapy to HYMPAVZI, 27% reduction. So that's specifically bleeding into the joints was monitored. And then again, for those individuals who identified as having a target joint, were there any bleeds observed during that 6-month observation period into target joints? And then during the 12-month period on HYMPAVZI, was bleeding observed in those individuals? And again, I mentioned trends. You can see 92% lower than the on-demand cohort, the on-demand group that participated in the trial, and then 25% lower with the moving from prophy to factor replacement therapy to prophylaxis on HYMPAVZI. And again, what is a target joint? Just as a baseline understanding, as the study defined it, if a joint has had 3+ bleeds in a span of 6 months, considered to be a target joint. Spontaneous bleeds. So again, 92% reduction in the on-demand cohort and a 35% reduction with prophylaxis. The important information here. And then for overall bleeds, so again, this is total. So could include things in addition like muscle bleeds. 85% reduction there, looking here at annualized bleeding rates for total bleeds, and 32% reduction with prophylaxis. And overall, what this is seeking to establish is, does the therapy work? Does the therapy work? So it's not about, I'll back up a minute. It's not about, is is this product superior? In the study, it's got to demonstrate that there is a benefit to this therapy. It has to prove safety, which we all understand. It's got to be safe. And then does it work? Efficacy, does it work? This proved with the endpoints that it met its endpoints and proved both, that it was safe and effective. And so again, superiority, that's not for anyone here in this room or otherwise to say to you directly. That is for you to align with your healthcare provider about therapy that's right for you. And I'll just share, I love that we're moving into a space where we can almost think of all of these treatment options as personalized medicine, really catered to your needs. So for safety and side effects, we covered off what to watch out for at the beginning of the presentation. Now let's talk a little bit about what was seen in the studies. So the watch out for, absolutely, it's those allergic reactions, those that are really severe, risk of blood clots or thromboembolic events, and HYMPAVZI may cause hypersensitivity reaction. So maybe hives, maybe itching. Again, the hypersensitivities, those are ones you really want to contact your medical provider right away. Consider stopping a therapy right away because you wouldn't want that to continue to get more serious. But within the trial, if we move over to the right, what was commonly observed was injection site reaction. You can see there the numbers are number of patients out of the 116 and then the percent makeup within. But effectively, what we're showing you are the side effects that were experienced in greater than 3% of all clinical trial participants. So injection site reaction was seen. People did report having a headache and also itching, surface itching. And from that, I just want to note that how serious safety is taken within these clinical trials. So really anything you feel, the participant is strongly encouraged to document that and report it. So so that's why you could see a host of things pop up. All of these reactions, if you will, we present in the data what the participants said to have experienced. So again, we talked about the risk of blood clots, and now that hopefully you're understanding this therapy, the rebalancing agents a little bit, like why we're talking about the risk for blood clots is because where this mechanism of action happens, which is on the anticoagulant side. So we do have to talk of anytime we're talking about that side, we'll discuss blood clots. And obviously if you're at risk for whatever reason to produce blood clots without medication or otherwise, like these are conversations to have with your provider for consideration. So the pen itself, I was talking to Fiona earlier, who you met when we all hopped on the line. So I know it's visually represented here on the page. I do happen to have a demonstration device. There's no real medication in this, nor is there a needle in here. And I'll show you how this works in a second. But let me take you through an overview of the product itself. So subcutaneous, we talked about, it's under the skin delivery, not into a vein or in the muscle. The device has a hidden needle. So what you're looking at there, you can almost see it to the right with the cap off, like you're not seeing a needle. The needle is hidden. There is a window there that you can see the yellow is almost an indicator as the medicine would be going in. How you store HYMPAVZI, it is stored in the refrigerator, 36 to 46 degrees, so not freezing. Be kept out. The dose for the week, it's 1 dose a week. That weekly dose you can leave out at room temperature up to 86 degrees for up to 1 week. So if you are on HYMPAVZI and you inject on a Wednesday, you can take your next dose out after that and leave it out for that week. Also important to keep it stored in the box that it came in, because it really was studied this way. So light sensitivity, that's what the carton container is helping it to do, is protect it from any light sensitivity while it's out at room temperature, and in your refrigerator is to keep it stored in the packaging that it came in. And for the dose itself, fixed dose means it's a single dose, no matter the individual. So we talked about how 300 milligrams is your loading dose or your starting dose, and then moving to a 150 milligram dose that would be used as prophylaxis. It comes in a pen device, so there's no mixing, no measuring. And this is where I'll pull up the demonstration. So again, there's no real medicine in this. There's no liquid, there's no needle, but it's designed to really show you how it works. And I have with me, I have a pair, which I'll enjoy after this session. Seemingly, this would be in your thighs, your abdomen, or under your arms, but utilizing the pair as one of them. In a moment, I'm going to push this device, which is basically, if you could tell, about the size of a highlighter. I think of it as highlighter. There's no clicking. There's nothing to push here, and there's also nothing to measure. There's no dial on this. It's a flat dose. So when I push, you'll see there's a spring there. You'll hear it click, and then as the medication loads, the indicator will fill. That would give the confidence that the medicine was delivered. When you hear the first click, hopefully you'll be able to hear it through my device here, through my laptop. The first click would be the needle that would come out with the injection. The medicine would load in the window, and then you'll hear a second click, which is the needle retracting into the device. This is considered sharps, medical waste, so it would go in your sharps container after each single use. So here I'm going to push into this pair. Hopefully you're seeing it well. Hopefully you hear a click. You can see the fake medicine, fake HYMPAVZI loading. Then you heard the second click, and then you remove the pen. This would go into your sharps, put the cap back on for safety, and then it goes into, again, considered medical waste. And we could hopefully have time for Q&A if there's some questions on that. But this is just a quick overview of the device itself, the cap, the window, and again, just really want to make sure everyone truly appreciates that the loading dose is 300 milligrams, which are 2 individual doses, and then moving to a single dose weekly. So what does this look like over the course of time? Day 1, you would seemingly do your loading dose, of course, under the guidance of your healthcare provider. After that loading dose on day 8, that would start your once weekly maintenance dose. If you should miss a dose, if this should happen, let's say it's Monday and now you wake up and it's Tuesday and you didn't take your dose, what that would look like in practice, it's in all the fine print with the product, plus your healthcare provider would know this. You call them and let them know, but seemingly you take your next dose immediately. So if I normally would inject on Monday and now it's Tuesday, I'll inject on Tuesday. You then have 2 options. If some persons are really fixed to a day in their minds, like they love it, you can move back to doing it Monday going forward, or you can start your next week from Tuesday. So there's a little bit of flexibility in there, not suggesting that anyone should intentionally skip out of convenience. Hopefully there's a good reason why a dose was missed. But that being said, should it happen, things happen, contact your healthcare provider, and then you're not at any less risk of coverage. As long as you're within a 2-week period, you're okay to, again, contact your healthcare provider, inject immediately, and then you could either move back to your regular day or continue, you make your new week from there. you happen to be beyond 2 weeks of, for whatever reason, missing your prophylaxis dose, contact your healthcare provider. I'm guessing you thought I would say that. Contact your healthcare provider, and then what you're instructed to do is begin another loading dose. So it's effectively taking that loading dose again, and then from there, starting your weekly regimen. So a little bit about access and reimbursement. You visit HYMPAVZI.com. All the information is there, so no one has to kind of furiously scribble anything down. It's all on the product's website, again, HYMPAVZI.com. And there you'll see there's a dedicated line for questions. Also, there's a specific team, a case management team that will just work with individuals, and really your healthcare provider would help get you enrolled in these programs and talk about what's potentially available for you. The other thing you can do is connect with my team. So with my team, we're the ones that you'll see, whether it's at the Bleeding Disorders Conference coming up later in Colorado in August, or at local chapter events, but also away from those events itself. Our team is always available to help address any questions you may have. So Fiona, I know, is kind enough. She's going to put another link in the chat, which is really a sign up, which would give you consent that you're consenting to connect with Pfizer, consenting to have someone from Pfizer contacting you to help address whatever your needs may be. So that brings us to the conclusion of our presentation. I have a post-session link up here to offer really, how was your understanding today? How did you think this material resonated with you? What did you learn? It's just 3 short questions. The link's going into the chat as well. I really appreciate completion of the survey, because then again, we're evolving this education really to meet the needs of the community, to meet the needs that questions that the community has, and really as understanding evolves of this therapy in the community, that's how the education then continues to evolve. So appreciate you filling out the survey. And then if you'd like to be informed about future events that may include, for example, patient experience, so on and so forth, definitely get connected with our team, and then we can make you aware of what's taking place, maybe more locally, closer to home. So I'll pause here and see what questions, comments there might be, and see how I can be of more help.
Super. Thank you very much, Brad. It was a really, really interesting presentation, really clear explanation of how something quite new is being used in managing hemophilia, how it works and how it's being used. So thank you so much for that. And I like the demonstration with the pear. I think that really helped to make it real. Just before we start the live Q&A, I just want to remind people to take a look for your chat. Your chat you should see a chat icon somewhere at the bottom of your screen. And there you'll see the links that I popped in while Brad was speaking. You'll see both the pre and the post survey, so please do fill those out. And then also the link to the HYMPAVZI site itself, and then also the one to connect directly with Pfizer. There's 2 separate links there for that. Just before we go to our Q&A, we do need to, for technical reasons, just let our LinkedIn Live and our Facebook Live audience go. So thank you so much for joining us today. It was really great to have you with us. Come and join us again next week. We'll have Dr. Navid Kadaprast and Amy Gaston from Spark Medical and OwnBody talking about their innovative neurostimulation wearable and its use in menstrual care. So please do come back for that. And just bear with me one moment while I let our good